On behalf of New York City Health and Hospitals, Kings County, and the patients we serve, I'm extremely happy to be here this morning to thank our council member, Eugene Mathieu, for his continuous support. The council member is a huge supporter of our hospital, no matter how difficult the budget season is. And believe me, I know it's difficult year over year. I hear the fights that goes downtown with the city council and the council member fighting for our hospital and other units here within the community. He has consistently provided much needed capital funding to enable us to upgrade and or purchase new equipment to expand the services we provide to the community and to ensure that our patients can continue to have access to state-of-the-art care. In fiscal year 2013, he allocated $5,551,879 for a new Linear Accelerator, which is the reason why we're here today. We were in desperately need of adding to our existing equipment to meet the increased demand of the community, which you've heard from Mr. Amy and Dr. Nakedi in terms of the need that we had in the community. What's had happened over the years is the fact that patients were coming here and staying late at night in terms of receiving the care, and also want to commend the staff for their commitment and dedication to ensure that we're here for our patients in the community. So this addition will spread in terms of the coverage that we need. We've hired additional staff, new physicians, new techs, physicists to support the operation here at Kings County. Having this new imaging unit is essential to providing improved access to care for our patients, as well as increased patient satisfaction, since it will lead.
From the bottom of my heart, thank you very much. I know you want to thank me, but let me tell you, I think this is my moral obligation to thank all of you. And I want to take the opportunity one more time to say a very simple word. Thank you. And thank you very much. To Mr. Baptiste, I want to commend you for your advocacy and for your leadership also. You have been here for about 4 years, but I don't know how many times that we met. And you did everything possible to make sure that I know what I have to do, to make sure that I fulfill the need of this great institution. Thank you for your advocacy and thank you for your leadership. To all of you, the gifted and devoted doctors, nurses, medical professionals, and staff, to all of you also, thank you very much, because you are doing every single day. God works. Thank you. Every single day you come to this wonderful institution to save life. And let me tell you one thing. If we can talk about the Kings County as a one of the state-of-the-art medical center, it is because of all of you. It couldn't have been possible. Not because of me. No. It is because of all of you. And I think that we in government, we have the moral obligation to provide you with the support and the resources that you need to continue to do the wonderful job that you are doing, saving lives. You know, the city is facing so many difficulties, so many challenges, housing, violence, jobs, and everything. But I think one of the most difficult challenges is lack of health, disease. Just imagine. I know you don't think about it every single day, but I want you to take a moment one time before you go to bed. Sit down a moment and try to realize the difference that you are making in the life of people in the community. The fathers, you are giving the chance to get back to their families. The mothers, the children. What you are doing every single day, I know it is not easy. Even the people that you are helping, some of the time they are not grateful. Especially the nurses. I know that you are facing also difficulties, because I have been working with the New York State Nurses Association to try to see what we can do to make sure that our nurses are respected. And to all of you again, I want to let you know that what I have done is nothing in comparison of what you have been doing. I am just a member of the team. I just want to join you. I just want to be part of the wonderful job that you are doing. And I want to let you know that I will continue to do everything that I can do to make sure that I get the funding from the city of New York and for my funding in order for Kings County to continue to be one of the state-of-the-art medical center, not only in Brooklyn, but also in the state of New York and also in the entire nation. You know, everything is connected. When we look at what is going on in terms of violence in our community, this is outrageous. I cannot tell you how many times I came here to Kings County because somebody gets shot, somebody gets burned. And all the time, every time that I come here, Mr. Baptiste always come to meet me, to join me. And every time that I come here, for my constituent, to make sure that they receive the services that they needed, I've been always received and treated with respect. And I commend you and I thank you for your support, for everything that you are doing to serve my constituent and also the people in Brooklyn, and also to help me serve and help my constituent. When I'm talking about violence, when somebody is suffering from any type of trauma, what they call Kings County Hospital. And you know that this is one of the three trauma centers in New York City. That the reason I spoke with Mr. Baptiste already, and I said that I'm going to advocate to make sure that the city of New York and the state of New York provide more resources to Kings County. Because you are doing a wonderful job in terms of, you know, giving the treatment to the people who are suffering from trauma. You need more resources. Let me tell you that on Saturday, December 7th, I organized a gun buyback program with the DA. Probably you have seen that on the TV, New York DA, with the Speaker, Melissa McVeverito, and the Commissioner of Police, to remove the guns from the street, because there are too many guns in the street. And who are going to have the trouble, the challenges to treat them? You guys, because they come over here. So let me conclude by saying that I feel this is a moral obligation for me to do everything that I can do to help you do the job that you love doing, saving people. And healthcare is on the top of my priorities.